everyone, this is Gayatri Sharma. Black fungus or mucormycosis. Have you ever heard this word? I must believe everyone is quite familiar with this word because this fungal disease has taken all the headlines of the news nowadays. It has also created a fury in everybody's mind. So let's try to find out what is black fungus. What is the biological basis of this fungus? How could we procure ourselves from this infection? Or what are the possible treatments available in our country? In this COVID time in our country, there are lots of things is going on, like lockdown, COVID, shortage of vaccine, some kind of myth which is prevalent in rural areas for not taking vaccines. So you could say that many more challenges are still there where we have to do some serious corrections for the betterment. Meanwhile, we have also facing one new deadly infectious virus, that is black fungus. Black fungus is increasingly becoming a challenge for the India. It has been reported in several states of India, mostly in post-COVID patients, people who have survived the virus but now face a new battle. Doctor says there is nothing to panic about, but there are lots of questions that are floating. Like, what exactly is this infection? What's causing it? How many cases are being reported and where are they being reported? And the most importantly, is black fungus life-threatening? The Center for Disease Control and Prevention defines black fungus as a serious but rare fungal infection caused by a group of molds which live freely in the environment, particularly in soil, wet surfaces, and decaying organic matter. People get infected when they come in contact of these fungal molds. For example, the lungs or sinus forms of black fungus occur after someone breathed in the spores. Cases are being reported at hospital in New Delhi, Uttar Pradesh, Jharkhand, Tamil Nadu, Telangana, Maharashtra, Bihar, MP. In a pre-COVID time, this infection was quite rare around the world. But since pandemic cases have increased due to the complications related to the virus. So let's talk about who are getting infected or is likely to be infected. So according to the Indian Council of Medical Research, there are 4 kinds of people who are quite vulnerable. The first one is those who use steroid during the COVID-19 treatment, thus lowering their immunity. Second, those who had prolonged stay at hospital ICU and yet to recover. Third, those with diabetes or history of kidney and heart failure. Fourth, those who are on medications for major health problems that reduce their ability to fight pathogens. The infections typically starts growing from the nose, upper jaw, and then travel to the brain. Experts says once it reaches the brain, it's a death sentence. So, if you are experiencing any of these symptoms, see a doctor at the earliest. The symptoms of black fungus: pain under the eyes, one-sided facial swelling, nasal or sinus congestion, stuffy or bleeding nose, toothache or losing of teeth, partial loss of vision. How do you protect yourself from such an infections? Expert says there are some precautions where you have to apply in your daily routine. Experts' advice are: first, wear a mask at all time. Second, wear shoes, long trousers, and preferably gloves if you step out into a market or park. Third, also maintaining personal hygiene. How can black fungus be cured? That's a big challenge. Treatment involves surgical removing all the dead and infected tissues, administering a course of antifungal therapy, but the drugs used for these therapies are very expensive and in short supply. So as we know that the therapy of this infection is quite expensive. It's not a cup of tea for everyone to afford this expensive therapy. We are quite aware about the condition of our country, right? So at the end, expecting anything from your government like better management, better treatment in black fungus, I don't think so it's going to work, because we are the witness. We have been facing the consequences of COVID-19 since last 2 years. Still our government is putting lots of efforts to alleviate the situation, to compensate the damage which has been made by COVID-19, right? So try to use the precautions which I have mentioned in this video. Stay safe, stay at home, and be careful. Thank you.